Hello and welcome to this tutorial by me, the Pharma Physician. This is my first time making a tutorial, so that's pretty cool. And if this is your first time looking at pharmacology, then I am so excited for you because pharmacology is the most beautiful science, hands down, the most beautiful science. This is really foundational information that I'm about to give you, and it's looking at what a drug-receptor interaction even is. It's very basic, but it's a springboard into understanding how the medications that you're giving to your patients actually work. First of all, what do I mean by drug?
Well, a broad definition would include any substance that has the ability to interact with one or more physiological systems. In our context, it's mostly going to be medications. So are we including like food and nutrition?
Yeah. No.
Now, the receptor is the specific place where the drug can interact with those physiological systems. And there are many kinds of receptors, and depending on the system, they could be located in different places. So, for example, they could be in the nuclei of cells, or in the cell wall, or in the bloodstream, or in blood cells themselves, or anywhere else where a molecule like this caffeine molecule could interact with a receptor, like this alpha receptor, like just out having a coffee. So this would be a typical example of a receptor. This one's a sodium channel. It's got 4 domains, as you see, and it's got that binding site, and it's located on the cell surface.
So in textbooks, you'll often see diagrams of receptors showed in cross-section. And that's just a simple way of showing simultaneously what's happening outside the cell and what's happening inside the cell. Now look at what happens when this molecule, this kind of hot pink blob, binds to the binding site on this sodium channel.
And in this case, the sodium channel is going to open, allowing sodium to flow inside the cell.
So this was a drug-receptor interaction with an outcome. That's the concept. That's all I want you to understand from this tutorial. You have a drug and it meets the receptor. Happy days. So I want you to just take a moment and just reflect on how many crucial physiological processes in the body rely on just the simple movement of ions across a membrane. The simple movement of sodium or potassium this way or that way. That's how your heart beats. That's how your brain synapses get regulated. It's how your muscles move by harnessing energy via sodium, potassium, ATPase. So pharmacologically, if you can manipulate ion channels, that is a super powerful way that you can influence physiology. So in this tutorial, we've looked at some really just foundational, very basic information to understand what a receptor is, what a drug is, and see how those two things can come together. In subsequent tutorials, I want to look at different kinds of receptors and also go into a bit more detail and give some clinical examples. Now, if this kind of content is helpful to you, please like, subscribe in the comments. Let me know what else is useful for you to know. And I'll see you next time. Peace out.